Hello everybody and welcome to the NAPCAN Child Protection Week seminar called Transforming Outcomes for First Nations Children. I'm Anne Hollins and I'm the Director of the Australian Institute of Family Studies. I'm also the incoming National Children's Commissioner and I'm grateful to NAPCAN for this great opportunity to facilitate this important webinar with my esteemed colleagues around me here today, who I'll introduce to you a little bit later. I'd like to firstly acknowledge the traditional owners of the land on which I am today, the Gadigal people of the Eora Nation, and pay my respect to their elders, past, present and emerging, as well as the elders on all the lands where you are participating today. The theme of the 30th anniversary of Child Protection Week is putting children first. This concept of putting children first seems a simple one and you might think an obvious one. It's obvious to all of us in our families, as parents and as grandparents and carers. We all put our children first. For example, we know that parents will go without in order to feed and care for their children if necessary. Which is why I think it's particularly jarring to us to see that at a policy and a systems level, children and their needs are often invisible. There often seems to be a deep disconnect between what we know and value and what we see our leaders value. Right now, we're seeing that with COVID. The health concerns of adults are preeminent because of the nature of this disease, and the economic policies are also focused on adults. There's very little public commentary on the well-being of children right now, children who are dependent on those adults who are experiencing financial or mental health pressures or suffering in lockdown. So putting children first means that children are visible and are heard and are central to our policies, along with the families who are caring for them. The Preamble to the United Nations Convention on the Rights of the Child describes the family as the natural environment for raising children. Seeing child rights and well-being in a relational and community context enables potential levers for action across numerous areas of policy. As a former frontline child protection worker myself, it's been disappointing to me to watch in recent decades the siloing of policy and services rather than seeing the child in her natural environment, the family and the community, and investment in supporting the family in its broadest sense to nurture the child's well-being and development. Along the way, we seem to have lost the systemic and contextual lenses that are so critical to children's rights and well-being. And a notable exception, though, I've observed, is the work done by Aboriginal and Torres Strait Islander leaders, such as those we are privileged to have with us here today. We know there's a great deal of work for us to do together for Aboriginal and Torres Strait Islander children. And we're very fortunate today for this webinar to have with us 4 commissioners who have a great deal to say about what's needed to transform outcomes for First Nations children and young people. Each of the commissioners will speak for about 5 minutes and then we'll go into a Q&A and panel discussion session. So at the moment, I'll just quickly flag who these people are. So on my right on the screen is Natalie Lewis, April Lawrie down in the red, Colin Pettit and Justin Mohamed down below. We're going to now just focus on Natalie for a minute. I'm going to briefly introduce her and then we'll move through every one of these commissioners for their 5 minutes. Please start posting your questions now, everybody, because you don't need to wait. And please try to keep your questions concise. We'll do our best to get to as many of them as we can shortly. So first of all, let me introduce Natalie Lewis to you. So Natalie was appointed Commissioner for the Queensland Family and Child Commission in May 2020. Natalie's a Gamilaroi woman who has a wealth of experience and knowledge from her over 20-year career in youth justice, child and family services, and Aboriginal and Torres Strait Islander affairs. Previously, Natalie held the role of Chief Executive Officer for Quatsip Limited and was a Snake board member for over 8 years. So a warm welcome to Natalie, and over to you.
Okay, thanks, and thank you everyone for joining us this afternoon. I'm logging in from Yagara country in Brisbane, and so as is custom, I pay my respects to their elders, and I hope that it is in our discussions today, and certainly our intent in being here, that that we continue to pay respects to all of our elders, and that the words that we speak honour all of our ancestors. I'm going to speak about the child placement principle. I apologise to those who have, had to hear me talk about this previously. It is one of my favourite topics, and I've got 5 minutes, so I think this will be record time if I can get through even the most basic of content. But one of the things I just want to, I think is important to start with is to be clear about what the Aboriginal and Torres Strait Islander child placement principle is not. I've heard it said in media every now and then by individuals that somehow the child placement principle is a statement about culture trumping safety. That's untrue and it's offensive. I want to be clear that Aboriginal and Torres Strait Islander children are entitled to the same right and expectation of safety of all of Australia's children. This is not an either or proposition. So let me also be clear that that consideration of a child's best interest is not limited to a point in time. An Aboriginal or Torres Strait Islander child's connection to kin, country and culture is integral to their immediate and long-term well-being. It's an enduring right. It's not an afterthought or just a nice thing to do if you can. As one of our good friends, Andrew Jacomos, reminded us often, our kids' rights to their cultural identity and sense of belonging is not discretionary. It's not subject to the level of cultural capability, contemplation or the convenience of the system or its actors. It's also not an exercise in political correctness. It's not a legislated excuse to ignore the neglect and abuse of Aboriginal and Torres Strait Islander children. It's not a second set of rules, it's not a substandard, it's not a double standard, and it's not one of those extras for Aboriginal and Torres Strait Islander children. It is also not just about placement. We've all come to know the child placement principle over recent decades as being about a hierarchy of placement. That's certainly how it is enshrined in the majority of legislation across the country. So while that was an important advancement, it's become this one-dimensional legislative response that has fallen far short of the original intent. As the child placement principle appears in all jurisdictions, except with Queensland, the hierarchy and isolation communicates to us that the point at which we acknowledge the significance of a child's right to cultural continuity and connection to kin and country is after we've already made a decision to remove them from their family. The work that we undertook through SNAKE and in the National Forum was an attempt to reclaim that original broad intent of the principle as it was imagined and advocated for by our elders and allies for decades. The hierarchy of placement is absolutely important. However, alone, it's not effective. It's only one of 5 constituent elements of the child placement principle as we've come to understand it. At the most basic level, the child placement principle is a restatement of the principles and protections that exist in domestic child protection law and those enshrined in the United Nations Convention on the Rights of the Child for all children. It is, however, unapologetically a sharpening of focus or a restatement of those principles in a consolidated way to ensure that there's this unambiguous point of reference for statutory officers to guide the involvement of child protection systems in the lives of Aboriginal and Torres Strait Islander people. The clear expression of these principles in the Queensland Child Protection Act as the 5 elements of the child placement principle was absolutely necessitated by decades of failure by statutory systems across Australia to equitably apply the existing principles and protections intended for all children and families in the context of Aboriginal and Torres Strait Islander peoples. So on the slide that's up at the moment, we've got the 5 elements of the Aboriginal and Torres Strait Islander Child Placement Principle. It's important to recognise that this is also accepted national policy. This was agreed as the description of the principles under the 3rd and 4th Action Plan of the National Framework for Protecting Australia's Children. All jurisdictions and their representatives through the Child and Families Secretaries groups all recognise and are pursuing priorities to advance each of these 5 principles in the work that they do with Aboriginal and Torres Strait Islander children in child protection. In my humble opinion, it's the quintessential framework for promoting the rights, safety and well-being of First Nations children and young people. I firmly believe that the faithful application of all 5 of these elements to the standard of active efforts is our best opportunity to redress the shameful rates of overrepresentation of our kids in statutory systems across Australia. And I'm probably running short on time, but if I can have 1 more minute, I think it's really important to flag the importance of the system elements, which is on the next slide, in applying the child placement principle. So we all know that that distance between the policy intent and the on-the-ground practice is often great. At times we can struggle to recognise that original intent when we look at the lived experiences and outcomes for many Aboriginal and Torres Strait Islander children involved with the system. So this diagram draws our attention, sort of gives us some guidance on how to safeguard that intent along the way. And it reminds us that unless we're really deliberate and diligent in our application of the 5 principles of the 5 child placement principles through the process, all the way from legislation through policy, programs, processes and practice, then we will lose sight of the purpose and the meaning of the principles. We'll compromise the quality of the outcomes that we can achieve for children, but worse still, we will be compromising the rights of our kids to grow up safe, connected to kin, country and culture. So basically, I'm sort of baffled that I'm not quite sure what's so contentious or egregious about the 5 elements of the child placement principle, or why a number of jurisdictions have failed to act in a meaningful way to implement them. But I think that what we've got in front of us is an opportunity. We're practitioners, we're policy officers, support workers and advocates, and I urge all of you not to wait. This is a tool that you can use today, that you can take today and use tomorrow to change the outcomes for Aboriginal and Torres Strait Islander children. There are 2 snake resources that we've made available to all of the participants, which absolutely cover the child placement principle and give us really good guidance about what best practice implementation might look like. And I certainly encourage you to share them far and wide. So thank you for sharing your time with me this afternoon, and happy Child Protection Week.
Thanks, Natalie. And wow, that was an amazing 5 minutes of very important information. I would like to come back to some of that in the discussion, and just for our NAPCAN helpers behind the screen, it'd be great to be able to put up those 2 slides again later. Might ask Natalie to say a little bit more about them in the discussion, given that she's had to rush through at this time. Thank you again, Natalie. So it's now my pleasure to introduce our next panellist, is April Lawrie. April was appointed as the inaugural Commissioner for Aboriginal Children and Young People by the South Australian Government in December 2018. April is a proud Aboriginal woman and heralds from the Mirning and Kakatha people in the far west coast, from the far west coast of South Australia. She's held a range of important executive leadership roles in the South Australian Government, including 4 years as Aboriginal Justice Director in the Attorney General's Department, 10 years as the South Australian Aboriginal Health Branch Director, and 2.5 years as Director of Aboriginal Education, amongst a whole range of other things. So, warm welcome to you, April. Thanks for joining us today. Over to you.
Thank you, Anne. I'm actually in Adelaide, and I want to acknowledge that I'm speaking from Kaurna land. Always was, always will be Aboriginal land. So you'll find that my speech has similar, I guess, connotations with Natalie's presentation. So putting children first, transforming outcomes for First Nations children. So as SA's first Aboriginal Children's Commissioner, I'm aiming for changes that enables the participation of our Aboriginal families and communities in decision making and policy making that keeps our Aboriginal children and young people safe with identity, belonging and connected to culture, and aiming to improve the ways that the system, or the systems actually, interact with each other, and obviously how the systems interact with Aboriginal children, their families and communities. I start with the premise that Aboriginal success is identity, which comes from, belonging to family, culture, connection to heritage, and absorbing Aboriginal ways and knowings. We know this to be true as being part of who we are. So I immediately go to the place of culture and identity, which means putting First Nations children first through a cultural lens when we talk about transforming outcomes. Putting our First Nations children first is about acknowledging our children inherit 60,000 years of culture and identity, and their lives matter. And this uniqueness is critical and continues with our children's connection to culture and identity through family and community today. If we don't put children and their identity first, we are at threat of losing everything that makes and takes us to be successful and thriving as Aboriginal people in this 21st century. So everything we do is for Aboriginal children. We look at generations ahead. So, the theme also resonates with the fact that we had National Aboriginal Honor Children's Day, that today's children is tomorrow's elders. Keeping our children safe within our families and our communities and culture will keep them strong, but will keep our culture will keep us strong. Because unequivocally, safety for the child is front and centre when interfacing with the care and protection systems, and so is to be cultural identity. Now, I'm saying this, but the child protection system is conflicted on this point, as evidenced in the outcomes for Aboriginal children and young people. We can change our systems to one that values and recognises the indigeneity of the First Nations child, relies and refers to the cultural knowledge from the Aboriginal family and community, and realises the benefits of cultural identity. However, across the service systems, our children and our families are up against the might of the dominant culture, whether it be policy and lawmakers, legal or social work practitioners, managers, executives, etc. That when the Aboriginal community demands cultural identity as an inherent right for the Aboriginal child, the contrary thought from the institution, which is inherently racist, is that we speak as if safety is discounted, and Natalie alluded to that the feeling is that we're favouring the rights to culture and identity over safety. Actually, they need each other so that the Aboriginal child can flourish and reach their full potential. We need to address the underlying assumptions that you can only have one and not the other. I suppose the facts speak for themselves with the reality. That said, when the system demands safety, and so it should, that is every child's right, but more so than often, culture and identity is not regarded. We know that to be the case with the spiralling levels of Aboriginal children in out-of-home care with non-Aboriginal care providers. And this is why the Aboriginal Torres to Islander child placement principle is crucial and critical within relevant legislations, and to ensure it's embedded in the service systems that interface with our children and families. And it shouldn't just be limited to child protection. I'm talking about education, housing, health, etc., youth justice. The service system does not have that institutional capacity to think about Aboriginality the way we do as the Aboriginal community. And, it is preoccupied with defending, its whiteness, which translates into defending bad policy and bad practice. It doesn't know it, but it subconsciously is fulfilling the assimilation policy through care and protection outcomes. So much gets in the way of Aboriginal children's right to family, culture and identity. That's why in the realm of Aboriginal self-determination, the agency of Aboriginal voice is critical if we are to transform outcomes for our First Nations children. Through my work, our children and young people have said their voices and their families and community voices have been absent for too long. In SA, we have almost half of our Aboriginal population under the age of 24. The value of their voice cannot be ignored, and without a specific focus on children and young people, South Australia will not be in a position to redress Aboriginal inequalities effectively. South Australia requires an Aboriginal community-led peak body, a model that preferences the voices of Aboriginal children and young people and their families and community. This peak body needs to be positioned to contribute to and to be an influencer in law and policy making, provide advice and information to government and others with independence and without bias. and with purpose, it can monitor the performance of the sector in relation to safety, care and wellbeing outcomes for our children and young people. And this goes hand in glove with the need for the resurrection of local level Aboriginal family care panels across our Aboriginal communities, ensuring local level family and community knowledge and expertise into the systems and to the processes, so we're able to influence better outcomes with respect to our vulnerable Aboriginal children and young people. So transforming outcomes for First Nations children will require genuine commitment to upholding their inherent right to family and cultural identity throughout the spectrum of the care and protection service systems. We know our strength to transform these outcomes for our First Nations children will come from working at the legislative, policy, service delivery and systems level to ensure family and cultural identity is embodied in the changes for the better. Thank you.
Thanks, April. Thank you very much. And again, we'll pick up on some of those issues. I'd like to hear a bit more about that family-led decision-making model a little bit later, but we'll do that in the discussion. I think you win the prize for the best backdrop of all of us today. It just looks fantastic where you are. Okay, so moving along then to our third panel member, I'd like to now introduce to you Justin Mohamed from Victoria. He's a Gurung man from Bundaberg in Queensland, though, who he's currently Commissioner for Aboriginal and Torres Strait Islander young people in Victoria. Justin has worked with Victorian Aboriginal communities for 20 years before moving to Canberra to take on national positions as Chairperson of the National Aboriginal Community Controlled Organisation, NACCO, and Chief Executive Officer of Reconciliation Australia. He's had a range of other jobs, but I'll just mention that he chaired the Victorian Aboriginal Community Controlled Health Organisation and chaired the Hume Regional Aboriginal Justice Advisory Council. He's been on multiple boards and committees and continues to be a director of Supply Nation, co-chair of Cricket Australia's Aboriginal and Torres Strait Islander Advisory Committee and board member of the Kayella Institute. Welcome, Justin. Thank you for joining us from Stage 4 lockdown. Hope you're doing okay there, and over to you.
Excuse me, Justin, we just can't hear you. Could you unmute yourself?
Okay, I try to.
Great, thank you.
Okay, I'm sorry, I didn't unmute myself. Everything's right now. Yes, thank you for the intro. It sounds like a long list of things to do, but it's all kind of ties in together, so it makes it easier. First of all, before I go any further, I want to obviously acknowledge the land which I'm meeting on here is with the Kulin Nation of the clans around here in Victoria, Melbourne. We are in the Stage 4, and it's been quite a bit of an effort. And anyone who's in this space at the moment, it has been quite testing, not only for us as individuals, but for the children and young people which we're supporting and advocating for. I'm going to take everything which April and Natalie have spoken about. It probably puts a really good lead into what I'm going to talk about now. I've got 5 minutes, which is not a long time, but talking about the Victorian experience. When we hear the heading of this particular webinar around transforming outcomes for First Nations children, the word that comes to me is about how do we break this cycle of overrepresentation right across every state and territory, but here in Victoria more than any, we've got some of the highest rates of Aboriginal children in care. So the experience here in Victoria, we've taken a bit of a different approach, and it's taken a number of years, and that is transferring the power, I suppose you could say, but the transferring of Aboriginal children that are in care to Aboriginal community controlled organisations, and not only just the care, but also moving down this path of guardianship, from moving the power from state to community. This has been something which has been mentioned nationally and internationally. It's been in a lot of ways the very first that any state in this country has considered this bold and innovative approach to trying to break this cycle and to bring culture, connection, and the caring for Aboriginal children back to where it's supposed to be, back in the hands of Aboriginal and Torres Strait Islander people. The conversations around this started almost back in 2005, 2016, so it was a long time ago. And so only yesterday I heard from a government official who said when he first heard it, he thought, wow, is this ever going to happen? Pleased to say that the goodwill of politicians, government, community, that we saw legislation changed. We saw policy changed and the funding which came in to open the doors and start this process. However, the learnings that we have seen, these aren't the only things that had to change for such a remarkable step towards self-determination, a word which gets used quite readily and used quite often around all parts of government and across Australia. But embedding self-determination into local communities, we've found that it takes more than just legislation and policy changes. We know for a fact that at local Aboriginal community organisations and their communities which they are governed and they have members of, they had to kind of seek and test, are they willing to take on this responsibility of caring for children? Is there have they got the appetite for it? Do they want to take on that responsibility? And that was some of the conversations which were held in local community, which I think is a big part of self-determination. The other components of this is the large community service organisations which have been subcontracted or contracted by the government to care for a number of our Aboriginal children in foster care and residential care services. For those services to step back, those services to hand over, to transfer the Aboriginal children, which meant not only the children, but also the resources. So their CEOs and their boards for many years have been funded to look after and to care for Aboriginal children. Now been saying we need to transfer that over to Aboriginal organisations. That came with a little bit of, dare I say, blood, sweat and tears with the conversations around that. The attitude of carers that were in the system for so long, the fear of the general community about can Aboriginal organisations, can Aboriginal communities take care of their children, all these things were very much tested and spoken about over a number of years. The shift to power and decision making and money all had to get played out. And what I can say now is that it takes time. It takes time to change the mindset. It takes time to change the power base. And right now where we're sitting, as we know that when children came into care, Aboriginal children came into care, when Aboriginal children were removed from their parents, for community, for Aboriginal people, it was like, that's the government's decision. That's the government's responsibility. Now we're shifting that back to now for communities to have a say, for Aboriginal organisations to have a very much day-to-day operational, but also generational care of our next generation. This has both been received in two parts. I kind of have seen as both in hope, but also has raised some anxieties. And for us to move forward, and where we're moving for now, we still have there's still critics from both sides. But can I say, if we're talking about true self-determination and breaking this cycle, this is where the rubber hits the road. This is where the shift of power moves from once a pretty predominant white institution to a community-based model, which we now are seeing results that have been leading the way here in Victoria around reunification, having families back together and children connected to culture, connected to country more than they ever had done before. So though it has not been easy, it is definitely a path which has to be walked. Thank you.
Thank you, Justin. That's really interesting what's happening in Victoria, and again, I'd like to find out a bit more about how that's working and why, and perhaps what some of the barriers are for the other jurisdictions in terms of looking at that kind of an approach. And we might have a chance to get to that a little bit later. Thank you very much. Last but not least, I've got to the pleasure of introducing to you Colin Pettit. Colin was appointed Commissioner for Children and Young People in Western Australia in November 2015. Hi, Colin. Colin has spent his career working to improve the wellbeing of children and young people, particularly in delivering education services and programs to children and young people living in regional and remote areas of Western Australia and Tasmania. Welcome, Colin, and over to you.
Thank you, Anne, and thank you to everyone who's joined us today. Can I also start by acknowledging our people here, the Whadjuk people of the Noongar Nation, a very proud nation, and they're doing some amazing work, and they should be congratulated on what they do. Can also acknowledge the power and the leadership that our three previous speakers have shown, and I am somewhat jealous that I don't have their wisdom and knowledge at my fingertips in this state. But I do want to put a bit of a lens on today's conversation through the eyes of children and young people. I've spoken to hundreds and hundreds of Aboriginal children across this state, and whenever I ask them what is it that they would like as a message given to important people, and I believe anyone listening to this webinar would be an important person in their eyes. And basically they say, can you please just acknowledge that culture is so important to me, and if people don't understand that, then they won't understand my heart, and therefore they can't engage my mind. And I think it's just a powerful story that I've taken many, many times. Can also, just before I start, for all of those who help out and walk side by side and work with our very vulnerable communities and people in a range of outback locations, this is Are You OK Day. I want to make sure that you take the time to reflect on your own health and wellbeing, because unless you're healthy, your support for some of our most vulnerable children will often be lost. So please take time to have a look at that. I want to start with just a little bit of a context of Western Australia. So I do have a slide, and I won't be using a lot of information, but I will show you the first slide, which will give a little bit of context of what we're talking about today. And I know these figures are replicated in a number of states across the nation, and in and of themselves are quite shameful. And we need to have a look at what are we really trying to address here. 55% in Western Australia, 55% of our children in care are Aboriginal children. And while we're seeing in 2020 that's slightly slowing down, that rate of the number of children coming into care for a range of reasons, including there's been changes of practice and policy here. It is still a figure that we need to be brave enough to have an open debate and not hide in the shadows of this, and see what we can actually bring forward. So I want to just talk a little bit about, and you'll see also there about how that translates into other areas like justice. And I won't read those to you, but they're figures that we need to actually be bold enough to have that conversation with. So I want to just touch on two things that we're trying to do here in Western Australia that hopefully will add to today's conversation. And then I'll finish with what I think are two obvious but needed steps in the way forward. So my next slide is around an issue that we went to a whole range of Aboriginal communities and asked what was the problem, and basically they said, we're tired of being asked. So what I was able to do in late 2018 was to have a forum of only Aboriginal leaders and Aboriginal people from within government agencies. We had two very bright young Aboriginal youth facilitate the day. And basically we asked them what was it they wanted, and they came up with a 2-page document, and these statements here would not be a surprise to anyone on the webinar, but they are very simple statements about what Aboriginal people believe needs to happen to help their children. And so we put that in a 2-page document, and it's available on my website. We sent it to all agencies, government departments, ministers, and also to a range of key industry leaders. And what we've been quite humbled with is that we are now seeing these responses from Aboriginal people being turned back into a policy, and they're being challenged back into communities to say, is this what you really want? So it has in some way taken small steps, and we've certainly pinched a lot of ideas from Justin in Victoria around that issue. So that's one thing that we've done. The second one is more around children itself. So the next slide shows, and this will be my last slide, you'll be happy to know. It was mentioned earlier by Anne and others about we need to refocus what we're trying to do into the rights of children. Every child has a right to be safe, to have a good learning outcome, to be healthy and connected, none more so than Aboriginal children and young people. So we went to whole groups of Aboriginal children and asked, what does it mean to you? What do the rights really mean to you? Their comments are hosted on that particular poster there. We've then pushed that poster out, and we now see it in a number of our regional hospitals, our regional police stations, our regional schools, and our regional libraries. And it says to Aboriginal children, you have rights to be looked after. There is not a small step, but it is a step, and it's something we continue to go back and visit with Aboriginal children in particular to say, is this still meeting your needs? And because it's their voice, and all of those comments are their voice, we've had great traction from around communities to say this is what Aboriginal children and young people want. So I want to finish with two things that I think are fairly obvious about how we can move forward. I won't touch on Natalie's already mentioned the placement principle. Absolutely imperative that we pick that up and use it for what it was meant to do. And certainly the work that that both April and Justin have done in their respective states show that when we really focus on the key issues, we can start to get traction. So the two things I think we need to do, and they're very obvious, and as we mentioned before, that we need Aboriginal-led solutions. But and I think Justin was very clever in the way he articulated that unless we do it properly, unless we support Aboriginal groups in a way that we're patient, but also we're supportive and not taking over, we can see that Aboriginal communities can actually address these issues. And we have great examples in Western Australia. Groups like Yorganup, who look after Aboriginal children and young people through care, do an amazing job, and we need to learn from them because they've had time, support and energy, but they're also led by strong Aboriginal people. The second thing that I think is really obvious that we need to have a look at, we've had two royal commissions in this nation in the last 5 years. Both royal commissions, one into child sexual abuse and the way organisations responded, and one into Don Dale. Both of them have strongly recommended that every state, and I mean every state, have an Aboriginal Commissioner for children and young people with a sole focus on looking at how we support Aboriginal children and young people in the future. Wouldn't it be great that every state had a Justin or a Natalie or an April that could get together at a national level and start to really talk about the issues and address the closing the gap in a way that we haven't been able to do before. It's something that is simple for government to enact. It's been called for by royal commissions. It should be enacted in every state. We've certainly been calling for it in here, in Western Australia. We're struggling to get the attention it needs, but it's something that has to happen. So, and I'm going to leave it there, and we'll go to questions, I think, from there.
Thanks, Colin, and thank you to all our panellists. So much to digest here and dissect. So we've got a little bit of time now. So if we could have everyone back on the screen, I'd like to maybe start with where we began with Natalie, your discussion of the child placement principle and principles, sorry. And I just wanted to make the comment, and remind participants that, hello, everyone's back now. I'd like to remind participants that those documents about the child placement principles, what are they, and as well as a guide to their implementation developed by SNAKE are up on there for you to download. And I'd highly recommend it because I must say I thought they were they are amazing documents, really, just simply from a good practice guide perspective, if nothing else. I mean, they're so comprehensive and there's so much in there for anyone working in this field, so I would highly recommend them. Natalie, I remember in our chat earlier you mentioned that one of the misconceptions about these documents and this idea of the child placement principles is that it's just about child placement, but that it's much broader than that. And it also goes to prevention, which is what I would like to have a little bit of a discussion about now, is how we actually prevent the unfortunate slide of kids going into care at all. How can this work on the child placement principles in its broadest sense assist with prevention?
Yep,
Natalie.
thanks, Anne. Okay, yeah. So, well, prevention is the first element of the placement principles, and it's really at its core about ensuring equitable access to quality, targeted and universal services, the supports that all families need for children to be safe and to thrive. It's in recognition that there is an equity in terms of access, you know, in all parts across the country, and there's not equity in terms of quality either. And so I guess if we look at the prevention, you know, the prevention element, we've had in the national framework, you know, obviously for a very long time, this desire to recalibrate the investment, move, you know, shift the focus to prevention and actually start to see a bigger quantum of that investment nationally move towards the provision of targeted and universal supports for families. But it just hasn't happened. And one of the things I can talk about that has happened in Queensland is that we've seen since the introduction of the 5 elements into legislation, what we've seen is a very deliberate strategy of investment in community-controlled organisations across the state to play in that space and deliver those types of services and supports that families need to keep kids safe at home. And so we've seen this massive growth in Queensland in the last 3 years, where we now have 33 community-controlled child and family wellbeing services across the state. The rates of engagement in those services by Aboriginal people has been incredible, and it tells us that there's not an issue with help-seeking behaviour of Aboriginal people as long as the services that they trust and that can deliver what they need exist for them and are accessible. And that's what we've seen in Queensland. You know, those rates of uptake, those services have also been able to demonstrate in that first 2 years that the rates of re-notification and substantiation of Aboriginal children and whose families have engaged with family wellbeing services is less than half of that of the rest of the service infrastructure across the state. So it tells us that there isn't an issue necessarily with the capacity of Aboriginal and Torres Strait Islander organisations. It's actually the capacity we're talking about is the resources to do the job that needs to be done.
So you're already seeing the outcomes of that approach in the reduction of kids going into care.
Yeah, well, I think data says, and I'm always skeptical about some of the data, but the data that we've been looking at says that the first time in 14 years in Queensland that there has not seen an escalation in the number of children, Aboriginal children entering care, or a proportionate rate.
Okay. Who else would like to comment on shifting the dial to prevention and perhaps in relation to these child placement principles or other reflections that you've got?
Yeah, and
Justin?
Go on, April. You're right.
No,
April?
I just wanted to make the point that the application of the Aboriginal and Torres Strait Islander child placement principle is inherently about preserving the identity, the spirit of the Aboriginal child and its relationship to family, culture and heritage, and that other systems, whether they be education, like I think I mentioned this in my opening remarks, whether it's youth justice, whether it's housing, health systems, need to understand that it also interacts with the child, you know, the care and protection systems, and how does it apply the Aboriginal child placement principle. You know, Natalie drives home that point all the time, that it isn't a set of principles that is about what you consider in terms of removal, but it's everything early on in terms of getting an early, whether it's early help, universal care, targeted care, you know, how can I say this? The point that I'm trying to get across is that we need to prevent our children from going into care in the first place, and all our early help services need to equally apply the Aboriginal and Torres Strait Islander child placement principles. And I think we have got a long way to go. I'm speaking for South Australia here as to what that actually looks like. We've a step in the first direction, I suppose. We've placed, I guess, contracting for services around Aboriginal kinship care with three Aboriginal providers. So they're new to this space, but it's really important that we take, you know, all the necessary steps to start building Aboriginal community control, Aboriginal self-management, Aboriginal self-determination, not just in the acute end, but also in the early help, universal care included.
So April, are you saying that as well as the community controlled sector that Natalie was driving the point about, that where they are present, there is no issue with help-seeking behaviour or addressing those important principles for Aboriginal and Torres Strait Islander children? As well as that, we need the broader systems of, such as education system, to also attend to these principles in the engagement with Aboriginal and Torres Strait Islander children. Is that, have I understood you correctly there?
Yes, you have. You have. And I suppose, you know, every jurisdiction is going to be somewhat different as to what level of development they are with the resources. You know, Victoria, we look to Victoria, Justin, with respect to how the Aboriginal self-determination approach through the, you know, the care and protection system plays out across the Aboriginal community controlled sector there. We've got to start taking that approach here in South Australia, and resources to do the job, actually, because I know our mob can do it. We've been doing it for thousands of years. Like Natalie said, we just need the resources to do it.
Yeah. Just on that, April.
Justin.
Yeah, just on that, I wasn't going to talk about this, but we just had we've got an Aboriginal Children's Forum, which has got the Aboriginal community control organisations, the community service organisations, all the departments, including the Minister and the Secretary, attend. It's probably the most powerful sort of statewide meeting, or probably any sort of meeting, because everyone's got to report back, and all their bosses are in the room, as far as the Minister and the Secretary and the targets which have been set. But one of the things that was mentioned only today, because we had the meeting today via Zoom or Teams, was that exact thing, is that, you know, if we want to try to break this cycle, the way this gets funded, the way communities get funded, can't be going through a budgetary cycle every time. If it's legislated, this is where our position was in Victoria, if it's legislated, it should be just as departments and everything else, we shouldn't be waiting to think, is the government going to support this again? Because this is about a generational, it's beyond any one term of government or terms of government. It's going to take, you know, multiple governments to see this broken. So that's on that point about supporting, other than the traditional way of funding Aboriginal organisations through that 1, 2, 3 year funding cycles every time. The other part to this is that, and in the time that I've been here, I went to one of the communities in northern Victoria, and it was quite interesting because Colin kind of touched on it. Where there's child protection, it usually also feeds to the numbers that we see in our youth justice system as well. So we're up there talking about a range of these things. And a group of elders, there was about 6 of them sat there, and they said, you know what? We know the 12 families that are in this town. Like, we know that their kids are going to be in child protection. Their kids are going to be involved in the youth justice. Why don't we just get in there and support and work for those families? We know where they live. Like, it's not even, we're not even waiting who's next. We know exactly what their issues are. How can we support? So these elders say, how can we just support these families so we can break that cycle for that one family, and then that kind of then moves through. And that got me thinking about that most of, not most, but we know that a high number of Aboriginal children out of home care, their parents were also have been removed at some time in their life, or their grandparents. We know these a number of these family lines, and so as soon as a child has a notification, soon as there is, the child has to be removed, because there is their safety, and their safety is the most paramount to make sure they are safe. What we're seeing in Victoria, when this model is back in the hands of Aboriginal communities and organisations, that not only the child gets removed and gets placed in a safe environment, the rest of the organisation then moves in with the dad and with the mum and works through the issues there. If it's about the housing, or if it's about maybe family violence, or drug or alcohol dependency. And I've seen in some of the cases this has happened, the rate of reunification is far shorter now. Those rates are happening so much faster, and moving back to a wholesome house, not just leaving the parents and say, well, you sort your stuff out when you're ready, then you can have your kids back, which we know that cycle could be, a child could be in out of home care till they're for 18 years and beyond. So we know that doesn't work. So the community wraparound services, the holistic approach, which we always talk about, putting this in this space where the parents are supported as well as the children and the kinship care, those all together having those right supports and the resources to do that, I think is a big way of stopping the next generation of that family going through the child protections. And we know these families, we know these young people. And to be fair, I'll finish on this note, but to be fair, we know children that are turning 16, 17, and they're in the justice system, or they're still kind of a part of the system, and they have a baby. Why wouldn't we put all our effort into those young families to say, we don't want your children to be killed? Keep that family unit together as soon, and strengthen that as much as we can.
So what you're talking about there, Justin, is acting early, which is what we really want to do, because if we don't act now, we have to act later, and it's just worse and more costly anyway. And so somehow we've got to work upstream to how do you do that? So what is it that enables the people in the community, the broader family groups, to wrap themselves around a family that's struggling that way? What levers do they need?
Yeah, and I'll let someone else answer that. But what my point is that we know these families already. We already know these children. We know the parents at a very young age. So we aren't waiting for, oh yeah, where do we put our resources? Where do we go? A number of these young people, a number of these families are well known to the authority. So if we can have an impact on them, that will see the numbers just in themselves drop, because that's part of what I'm saying as well. We already know who these individuals are, where they live, what their backgrounds are.
What I'm interested in, perhaps someone else might like to comment, is how do we get that happening everywhere? It makes so much sense to do that. What are the barriers, and what do we need to do to address the barriers? And perhaps, Colin, do you have something you'd like to say? And everyone can have a say about that. Colin.
Yeah, I will, thanks, Anne. And I do acknowledge that Justin's exactly right. We know where these children are that are most troubled, and how we can support their families. What we don't have is necessarily trust from government or agencies to actually let go enough to do things differently. And so already Justin has mentioned about how do you change the tendering process to ensure longevity of the program, rather than we're going through a cycle every 2 or 3 years. And we're seeing it here, and not just in Aboriginal organisations, but particularly in Aboriginal organisations, where the uncertainty of funding breeds real concern about, can we continue our service, and takes away the direction, if you like, of trying to actually address the service, but more keep the service afloat. And so we need to get smarter. And if you're talking about transforming, putting children first, I think Justin's point about having long-term funding processes, changes to the way we legislate, being patient, but supporting those organisations in a way that we haven't done before.
And if I can add that around the elements of participation and partnership are incredibly important, and they're probably, I guess, the shining light in terms of the reforms in Queensland. So that participation focus has enabled the rollout of Aboriginal and Torres Strait Islander family-led decision-making across the state, which is facilitated by Aboriginal and Torres Strait Islander organisations. So the primary focus is really to support the participation of children and families in decisions about them. What we've seen is an extension of that through another amendment within the legislation, which is about the chief executive being able to delegate not just guardianship like in Victoria, but any and all functions of the chief executive to an Aboriginal community controlled organisation. And so what we're seeing is this sort of iterative approach where it's not just, you know, it's got to be all or nothing. It's actually starting at a community level to see what are the types of things, the types of decisions that if we made those decisions, we would improve outcomes for the kids in our community. And so we're seeing sort of these shifts in delegations emerge that are right for that particular community, and most importantly, right for that individual child, because all of the delegated authority positions relate to individual children. So it's not just a wholesale rolling out of responsibility and risk to community controlled organisations for different functions. It's actually contingent on what is best and what is in the interest of a particular child. And I think that that's a measured, but I think more sustainable way of approaching that shift in authority.
And that's, you've got legislation to support that by the sounds of it. So that goes to the different system elements you addressed earlier, that really it's not enough to just expect people, you know, local people on the ground to get up and do it. You need it to be supported at all levels and for it to be enacted properly. April, did you want to comment?
Yeah, and tying into that, just with respect to the new Closing the Gap plan, and, you know, for the first time, we now see one of the key outcomes and targets is about addressing the overrepresentation of Aboriginal and Torres Strait Islander children in the child protection system. But what's really important in that and where it's placed is how we get the interaction of the housing target, the youth justice target, even the native title and land target, the health targets, interacting to ensure that we have a much more greater and robust systemic approach to addressing economic disadvantage across our Aboriginal communities, because the intergenerational trauma is also the story about intergenerational poverty, and we need to do, you know, the focus on the child and their family. That is so important, but then above that is also the systemic changes that need to happen at the macro level, so that we're driving economic development and reforms in those areas that actually benefit our communities and our families and our children. So that sustainability is cross-sectional, and, you know, there's opportunities here with the Closing the Gap plan and having Aboriginal community controlled embedded in it as a key way forward is going to at least provide, you know, yield some better outcomes for our children and young people.
Yes, that's what struck me too, April, about the Closing the Gap agreement, that it really does, if you read it closely, you can see how it is a sort of a cross-portfolio view, whereas often when you're talking about First Nations children, it's just like the Child Safety Department involved, you know, like it's sort of so narrowly focused on needing to change how child safety officers work or whatever. Actually, this is much bigger than that, and I think that's what's come through in this discussion already, is we need change on so many different levels. Sounds like you have a bit of optimism for that Closing the Gap agreement having some potential to make a difference. Am I hearing that from you, that there's a little bit of optimism there?
Yeah, optimism, particularly for the fact that the engagement of the Aboriginal community controlled sector in the development of this agreement and influencing the tabling of the outcomes and the descriptors around the indicators has been heavily influenced, unless someone tells me otherwise, by our Aboriginal community controlled sector. So with that in mind, the fact that we've got the outcome 12 being dedicated to addressing the rates of child protection and going into out of home care, for me is quite compelling, because those aspects weren't there in previous iterations of the closing the gap and indeed the targets. So I just think that the centering of it within the plan just gives the topic prominence and is another opportunity to actually galvanise better outcomes for our young people.
Would anyone else like to comment on closing the gap agreement before I go to participant questions?
I'd just like to say that the new refresh closing the gap, it's great to see that they have this target now, which is broadening just from the traditionally what it was, health and education, now to the over-representation. And we've talked a fair bit at the moment, which I think is very important, about how do we get in early and the prevention and giving communities those supports and giving the self-determination, the opportunity for that self-determination to really happen. But we also can't forget and can't leave out that the system that we have at the moment is still not doing the best by the children, our children that are in there. And part of the powers and oversight that we have in Victoria here with the Commission, with the child deaths inquiry, every child that is in out of home care that dies comes to us for our review. And it's sad and it's painful to go through and seeing how young people have lost their lives because the system hasn't been quick enough to respond or haven't listened to the calls of help and the signs that are so evident there. And so that's still the system that we have, and it's not just an Aboriginal issue, and waiting for Aboriginal organisations and say, hello, are we ready now? It's going to take a whole of government and and society, everyone who kind of works in this space, because the system that we have, we aren't getting our young people through that come. A lot of our young people don't come out stronger than when they first went in there. We're finding, they come out with extra trauma and brokenness, which is something that we've got to look deep out about how do we reverse that as well.
Absolutely, can't agree with you more. Natalie, did you want to comment on closing the gap?
Oh, look, I'm happy to move on. It's important, obviously, to raise the profile as this is an issue, and to actually be able to flag that eradicating or eliminating overrepresentation is sort of, if we think about overrepresentation as that that litmus test for social policy more broadly, we've got to utilise this opportunity through closing the gap to actually, recognise that the solutions to this lie outside of the child protection system. And for far too easy, it's been flicked past and positioned as, like as if we're going to find the solution within the system that harms our children. Like that's not, not logical. So
that's exactly right. And I think, the thing that exercises me is how you get accountability in the other systems that actually don't see this as their problem, right? We've actually got to really lever whatever we can to make the other systems accountable and change accordingly. I might, if everyone's happy, I might go to our participant questions now. Everyone's been very patient watching so far and listening to the conversation. I might just stay with the child placement principles for now because there's a few questions on that. So I might just let three, I'll read the three and allow you to comment in whatever way you want on them. So one is, do we have a problem with child protection organisations treating the child placement principles as optional? Is that a problem? They see it as optional? Perhaps I'll just throw that out. Is that a yes? Yes from Natalie? Nodding?
Yes, that's a problem. That's absolutely a problem. It's not discretionary. it's law, you know. And I think that you know, sometimes there's a bit of there's hesitance, you know, in terms of people not feeling confident, or, you know, like in terms of how they approach it and apply those principles. But, you know, there's an obligation that if you don't know, you go to who does, you know. And I think that, yeah, I think at the moment it is still very much, as we see the rollout across Queensland since the amendments to the Act, we see there are parts of Queensland where the uptake is slow. But we see other areas that are absolutely embracing this as that framework for working with Aboriginal and Torres Strait Islander children and families, and they're seeing outcomes, and the practice shifts are occurring. But I think for us to really make a dent in those numbers, it has to be on a much grander scale.
Yeah.
Okay. And you know what? There are absolutely no consequences there is for the child, obviously, and their family and their future. And as we heard from Justin, we know that the outcomes aren't good once they're in the child protection system, particularly long term. But when there is failure on the system to actually adhere to what is legislated in terms of the Aboriginal and Torres Strait Islander child placement principle, there is no consequence whatsoever. And so driving that accountability and monitoring the performance of the care and protection system is essential. But understanding that when you have something that is legislated that is really key to the future well-being of Aboriginal children and young people, and that yet we see actually, and I'm talking about South Australia, a growth in Aboriginal children going into non-Aboriginal care, like, you know, removals beget removals, but also, you know, out of home care with non-Aboriginal care providers is on the increase, and it is an issue that we need to address. So understanding that it's there in legislation, but it can be explained away by other reasons as to why a child ends up in non-Aboriginal care. That's what we're systemically have to address and develop approaches that really embed, like, you know. And I think you wanted to raise a question with me earlier in your opening remarks when you introduced me around family-led decision making. And we know that, you know, if that's in legislation, so be it. But is it adequately resourced? Do we have structures out in our Aboriginal communities? We do, but they're not adequately resourced, that can actually maximise the Aboriginal families' participation in decision making on matters that are affecting their children and young people, and ensuring that involves local level mechanisms as well. And, you know, we did have those systems here in South Australia, you know, and at one stage South Australia was a lead in those innovative, you know, culturally, you know, informed, innovative, you know, activity that actually embraces and centres the Aboriginal child with their family. And so for me, I guess what I want to hit home is that while there is lots of work to be had around holding the system to account, actually, let's put a lot of energy, because that energy needs to be directed to where the Aboriginal investment is, which is in our own mob and our own communities and our families, to actually build our own, you know, cultural systems that can further the Aboriginal child.
Thanks, April.
Yeah, look, I think this conversation and this point about how well, even when things are legislated, how they're picked up, and especially for this part, these principles, which are based so much about the value of Aboriginal culture, family structures, you know, that's the base of this. This area has been built on, and I spoke at a group the other day, but this whole child protection area was built on, right back, if you want to go back to the stolen generations, that Aboriginal parenting and Aboriginal families and Aboriginal upbringing wasn't sufficient enough. There's deficit. It's a deficit model. So we need to step in and save these children or give them a better chance of life. Now, I'm not saying that that's still the mentality which happens, but that's the genesis of what we've got, this overrepresentation. So there is a big part of our society, and I challenge many people that I spoke to, people that are my age or even a bit younger, what they were taught at school about Aboriginal people, what they read in the newspapers, what the conversations around their dinner table with Aboriginal people there, or how their friends talk about, has an influence of how we value when we say Aboriginal culture. Do we value Aboriginal parenting? Do we value the return, to connection to country and what self-determination means to a group, and what language and having that identity? I don't think we are at the moment as a society. We haven't fully embraced the strength and the value that can come to contribute to fix this these issues. And usually culture, from my experience in Victoria, cultural support plans, Aboriginal-led family-led decision-making processes are always the last thing that happens. There's a whole much, because it's kind of, if people realise that if we get that up front, then that can make a massive difference. People would do that, but we haven't quite valued that yet. And I think it's a society issue, not just in this area, but it's broader than that. Until we start breaking into that, and maybe this might be one of the best areas to lead this on. But I think and as Aboriginal people, we know that culture and do things culturally right is the key for so many things. And it's not only just keeping families together and keeping strong, but our health and our prosperity, etc., etc. So I think that's a part we grapple with in this new term of the terminology and new legislation that's been rolling out. How does the broader society embrace that and value it?
And Justin, further to that, sorry, Anne, just one thing that I'm seeing is how reports around attachment theory are based on the white dominant approach to child rearing practices. We've got to have more of our culture and identity in those systemic areas around attachment theory, because what I'm finding is that is actually absent in many cases where there are arguments around stabilising or making permanent a child in non-Aboriginal care is attachment theory, and completely devoid of actually Aboriginal attachment theory, and understanding that we have a history that is built on ways and knowings that needs to be integrated and centred into any decisions that relate to our Aboriginal children and young people.
Absolutely. I think, what you're talking about there is systemic racism and the cultural norms of this country, the social norms through which we view, because of ignorance and lack of understanding, we view the actions that need to be taken and therefore opt out when it seems all a bit hard, right? So I think that there's so many layers of behaviour change that we need to address that you're talking about there in those broader systems. And there's a couple of questions that go to this issue. I'll go back to the participants. There's one that says, how do we challenge the notion that Aboriginality is a risk factor?
Oh.
Can we start by getting rid of actuarial tools that actually calculate Aboriginality as a risk factor? Can we start there? Like with things like structured decision-making tool, and look at the inherent cultural bias in a number of things that we reach, off the shelves, and think that somehow that's going to improve our practice. And it's like, can we get back to basics? Can we talk about, respect and compassion and knowing when you're not best placed to do something or to make a decision? And it's, I think that, one of those, I guess one of my frustrations is around the use of things like structured decision-making tools, and the way that inevitably they will always paint a picture of dysfunction and despair when it comes to Aboriginal and Torres Strait Islander children and families. And that means from that first point where we're making the first set of decisions, we are inevitably going to make bad ones. So I think, yeah, maybe that's just a suggestion of where we could start.
I was in a meeting with again, it was a lot of the CEOs of the community services organisations, Aboriginal organisations, some of the lead organisations, and the minister and the department here in Victoria. And for about, the agenda was about how do we strengthen, and how do we, you know, strengthen this child protection area and get the numbers across to the community controlled organisations, and, you know, basically delivering on the legislation. And about 80% of the 2/3 of the meeting was so much focused by the department and even the CSOs of how can we better support the community to step up to this level. That's what, and I'm sitting there listening to this, and it was all good, and a lot of the Aboriginal organisations were sitting there, and I just thought I had to interject, because there was not one time any of the departments or the community service organisations looked at themselves and say, well, what do we have to do better? It was all about how we can help you. And I think that's the imbalance, that it's, well, how can we help the Aboriginal family, or how can we help the community to step up to this, whatever magical line is of you know, of functional. But there's very little inward looking from the people that have contributed to this trauma and to where we are as a nation, which is, as mentioned, the culture, and it's the departments, the government, and the big CSOs out there that have all played a part of reinforcing those sorts of disadvantaged, dysfunctional attitudes. And we're here to help, but to reverse that around and say, what do we have to do to change? And that was a meeting which we kind of pulled it up. It got a little bit heated, but it was quite interesting that people came back afterwards and said, yeah, well, we haven't really looked at how we can improve. We're just looking about how we can help Aboriginal communities all the time, or families. So it takes a bit of that reverse, or inward looking, I should say.
And there's also the view that you know, people have about Aboriginality, that it's aligned to poverty and disadvantage. So the messaging about addressing some of the stressors in the child and families, you know, circumstances, don't get pitched at what is actually going on in terms of issues around maybe homelessness, maybe issues around domestic violence, but actually labelled to do with their Aboriginality, which is everything we've been talking about is not that. That is their, you know, experience of matters to do with, you know, intergenerational trauma, intergenerational poverty, notwithstanding, you'd have to deal with the safety issues. Like, you know, I always say that is a given. However, when you're dealing with systems that label, you know, and pathologise race as a risk, and without looking at social circumstances, what is going on in terms of the lived experience of that child with their family, or the children and their family within their community context, you're then establishing an approach that is then really setting up a system to be inherently racist in their approach and their outcomes.
Yes, I don't know if you share my view, but I think in this country we struggle to talk about poverty as a thing, and so maybe it's easier to kind of you know, locate the source of the risk somewhere else, because we're not comfortable really addressing the fact that there is structurally we set people up to fail the way we do. Colin, I'll come to you now, because you haven't had a chance for a while. Do you have something you'd like to throw in?
Look, I've really enjoyed listening to three experts here, but I will add just a little. I agree with Natalie. I think the question from the person online really does highlight the problem in that we are, by using Aboriginality as a measure, if you like, what we're doing is actually reinforcing racism. Instead of saying, what is it every individual child has or needs to contribute to society, and then what do we need to bring to that? And if that child is an Aboriginal child, then what cultural other support do we need to bring to them? And that, I think, is where Justin was talking about. Agencies haven't reflected enough. They kind of lump everyone into pockets, and that's expediency more than anything else, instead of addressing it individual case by case. And if we did that, then maybe we would have that transformation that this whole webinar is supposed to be wanted to talk about. Whereas let's look at the rights of children first, and then look at that child's specific needs, and if they're an Aboriginal child, what do we need to do that supports that child? That would be my only comment.
Thanks, Colin. And to your question earlier, Justin, that I don't know, I didn't get from your story whether you actually posed that question at the meeting or wanted to, but that question that we should be asking ourselves, what can we do better, look to ourselves more. You'll be pleased to know there are a few questions online that go to that, about what it is that government officials, education providers and so forth should do differently. We're not going to have time to go to all of those individual questions, but I think that amongst the participants there is that questioning about what is it that I could do differently, or I and my colleagues could do differently. Do you, at a general level, beyond that, asking that question, what's the next thing that can be done by those people who should be looking at themselves and their own behaviour and their own attitudes? Do you have any general comments about that?
Yeah, probably need another webinar, I reckon. On that alone.
All right.
Look, I mean, just quickly, it's this is my opinion and experiences, is that, I mean, it is about self-reflection. And when I say self-reflection, as a professional, or if you've got a leadership space and what your organisation stands for, and it's understanding too who you're working with. And if you understand that, like, you may come with all the best intentions, but if the community or that family sees you, or who you're, whatever the logo is on your t-shirt or whatever it might be, as something which is a threat, you've got to understand that. But I'm more and more, the older I get, is just thinking that, that we're asking people to flick a switch and say this is the new way of doing things, but we've got to allow people to do their self-reflections about their own biases. What's their view when they see an Aboriginal man walking down the street with a child? Is it a healthy view? Is it about, well, or do we just, they don't have any sort of view at all? Well, what's our feeling when we drive and we go to visit an Aboriginal household? Or, I mean, there's a lot of these things which kind of sit inside, and people, I think, in our nation have been a little bit, or not a little bit, have tried to just kind of push that to the side and say, well, it doesn't really affect too many people, we can just get along with our life. But I think we're seeing, as in this new world that we live in, that those things need to be unpacked. And I think in some ways, some of the things that have been taught and have been kind of influenced us as a nation have to be unlearned. And that's going to take, and organisations would have that same space of unlearning how they may be doing their business, which might be that's the way it's always happened, but now we're working in a different space. And if we're wanting Aboriginal people to come in and sit around the table as equals, that's what all these all these areas are demonstrating, and self-determination, well, then that means that you may be the person who spoke the most, you may be the organisation that takes the lead, or the department seems to should have all the answers. It may be time now for you to take the back seat or step back and let the people who this is designed for to have the solutions which are set up. So I think it's a lot about self-reflection and being honest about where your biases sit and how you really feel about some of these, you know, the principles. Yeah, I'd say sit down and really discuss or think about yourself. How do you really feel about these principles? Do you think they're just some pretty words written on a piece of paper and they're never going to happen? Well, if that's the case, you need to talk that out amongst yourselves as a group, and then come to move forward. But don't push it to the side. So that would be my quick thing: is self-reflection is something that has to happen, and truth has got to start being spoken about. And a lot of answers are sitting there with the people that we see needs help. And we've found that, I'm sure, and I know April's done some work around this, and Colin and all the commissions have. When you start talking to young people that live in this space, they give you the answers and they give you so much insight, but we just don't take the time to listen and step back and let them. And that's what I'd be saying across for the right across the Aboriginal space as well. That let Aboriginal people lead these things and walk with us, walk beside us. Yeah.
And can I add this? There was this around this concept of allyship. There was this amazing thing I saw on Twitter. It is. I'm not claiming credit for this. It was a random thing I saw. It was an Aboriginal woman from Melbourne, I believe. But it had this concept of an ally. The A stood for always centre the impacted. The L stood for listen and learn from those with lived experience. The other L stands for leverage your privilege, and the Y stood for yield the floor. And I think for us, like, we've been struggling with that, having those conversations here at the QFCC about how do we be allies? How do we actually make sure that those that are marginalised, whether we're talking about Aboriginal or Torres Strait Islander children, children with disabilities, how do we stand in the right place to be the best support? And for me, those words were really strong, and I promise I'll come back to you so you can circulate it out so the right person gets the credit for saying that.
I'd love you to do that. That's perfect, isn't it? That's fantastic.
Yeah.
Thanks, Nat.
Yeah. Yeah, well, for me, it goes back to the point that Aboriginal culture expertise sits with Aboriginal people, and the Aboriginal family and their community is the expert in the Aboriginal child's experience, and no one more better than the Aboriginal child themselves. So Aboriginal engagement, Aboriginal participation is central. So if we know that the workforce that sits there in the care and protection system is so removed from the lived experience of the Aboriginal child and their family, but nothing goes beyond the fact that when you acknowledge that you bring your own values into your workplace, you bring your own discrimination into the workplace and acknowledge those things, but actually have a belief in engaging on a relationship basis, because for Aboriginal people, we know this, that we build relationships not because you have authority, but because we have a relationship with you. And with that relationship, we get to know, it's mutual understanding, but it's also about how you connect and how you're able to use that connection to assist someone. And, and I agree thoroughly with what Justin and Natalie has said. But at the same time, you got to ask yourself, what is your checklist when, what motivates you in working in the Aboriginal space? Are your approaches, genuine or authentic? Do you really want to make a difference? And do you actually want to engage with Aboriginal people to create better outcomes for Aboriginal children and young people?
We're going to have to wrap up on that note, and that's a fabulous place, I think, for us to leave us. Can I just say that I felt quite moved by the reflections, particularly in this conversation. I'm sure that there's been an enormous amount for participants to take away, and I really thank you for I deeply respect what you're sharing now. I think there's an awful lot of unlearning to be done here. A lot of unlearning. Before I wrap up the webinar, I wanted to say to participants there's a short survey to be done at the end. There will be a recording available, and I'm sorry if we didn't get to your question. But I think you'll agree with me that we've really been beneficiaries of some very important reflections that require us to do a lot of deep self-reflecting now. And I thank all the participants for joining us today. But on behalf of all the participants, I would really like to thank all of you, Colin, Natalie, April and Justin, for sharing your time this afternoon on an extremely important topic. And I look forward to working with you all in the months ahead to collectively try to shift that dial and to try to transform outcomes for First Nations children. So thank you very, very much today. And I think on that note, we'll just wave and sign off. Thanks everyone for joining in.
Thank you.
Thank you.
Thank you.
Thank you.
Bye everybody.